Sorry, kena ambil angin dulu. Cool down. Kena cool down dulu. So ambil you all ni 1.5 jam tension. Rizan.
Bismillahirrahmanirrahim. Assalamualaikum. So today the chief complaint, Ahmad, 1 year 2 months old boy, was admitted to ED emergency department for rapid breathing for 1 day. So the HOPI, the patient was well until a week ago before he developed cough, and the cough was dry and there was no sputum. The cough was sudden on onset and occurs intermittently. There was no specific pattern for the cough as it was not worsened at night or early morning. And he coughed until the day of admission. The cough was not exacerbated by coldness or dust, pets or allergens. And there was no other associated symptoms such as fever or runny nose at that moment. And then 4 days prior to admission, he started to develop fever, and the fever was sudden in onset and intermittent in nature. But the mother couldn't recall the temperature of the fever during that time, but she said that the temperature, the fever was mild and the temperature was not high grade. And there was no associated chills or rigor. But at this time, he had runny nose, and the natural discharge was clear in color. The fever was temporarily relieved, but then it returns as it was intermittent in nature. And then the fever persists until the day of admission. And then 2 days prior to admission, he developed a sudden onset of rapid breathing. Mother noticed he woke up and started to become irritable. But then the rapid breathing did not cause him to wake up. And at that moment, he did not do any physical exercise such as playing. And then the rapid breathing was intermittent in nature, and there was wheezing when he was breathing. And then he went to KK and get nebulized for 2 times, and paracetamol was prescribed to him 1 day before admission, and then the rapid breathing relieved temporarily. Next, on the day of admission, the rapid breathing worsened 1 hour before admission, and he was brought to ED and nebulized 3 times but not relieved. Upon further questioning, the last similar episode was during he was 4 months old. At that time, he was given 3 times nebulizer, but then he was not admitted. And then there was a family history of his 4th siblings. He had bronchial asthma, and also his father and 2 elder siblings smoke, and they have a pet cat. Otherwise, there was no contact with sick person in household. The patient is just active as usual. Oral intake is good. No vomiting, no diarrhea, no fleeting episode, and also no eczema, no allergy rhinitis, no history of recent traveling, no history of recreational freshwater activities, no history of rodent contact, and he is not from dengue prone area. That is all for HOPI.
Finish already.
Yes.
So Swani, any question? Sazwani?
Yes, saya.
Any question?
Okay. How about his birth history? Birth history.
Birth history,
About his birth history, he was born preterm at 31 weeks. But then just through spontaneous vaginal delivery. At that moment, when he was born at preterm, his weight was 1.7 kilogram. So he was admitted to an ICU for about 1 month and 2 days. and then discharged when he was stable after that.
Najiha?
May I ask about his immunization schedule? If he completed the immunization?
About the immunization, according to his mother, he already completed his immunization up to his age. The last one was MMR vaccine.
Umi?
Is there any eventful antenatal or postnatal history?
Mm, he was born preterm, and then he was admitted to an ICU. Other than that, there was no eventful postnatal history.
Izian?
I want to ask, does this patient have chest pain? And if so, what is the characteristic of the chest pain?
How old is child? How many?
1 year, 2 months.
Hmm.
Chest pain? You asked for chest
Tanya,
pain.
tanyalah Azwan, Izian.
Yes, chest pain.
Chest pain in 1 year, 2 months. Jadi tanya Izian, chest pain in 1 year, 2 months. What do you think?
If this patient have chest pain,
Chest pain in 1 year, 2 months. How 1 year, 2 months child tell the mother that he has chest pain?
maybe no, the child cannot tell the mother.
Don't you think the question is silly?
Yes.
Any other question you want to ask?
I want to ask, what is his nutritional status? Does he still on breastfeed?
Dietary history.
Yes.
Now he drink formula milk because he only exclusively breastfeed until he was 3 months old.
Then?
And then he changed to formula milk. And in a
How
day, he
much?
drinks about 4 bottles.
Milk only, nothing else.
He also able to eat solid food such as rice or sometimes mashed up food.
How much he diet the milk? How much is it?
4 bottles with 5 ounces each. So about 20 ounces per day.
Okay. Nabila?
I would like to know beside the symptoms like tachypnea, does the patient also experience other signs of respiratory distress such as labor breathing, chest wall recessions, or cyanosis?
As reported here, there was no other symptoms other than tachypnea. There was no there was no labored breathing or cyanosis. But there was chest wall recession. Yes. So he had tachypnea and chest wall recession.
Al-Hakim?
Yeah, I want to ask about his developmental milestone or developmental history. Does he able to talk, walk, or grasp any object?
According to general examination, his body build was normal as other child, and
Dia tanya
for
developmental.
developmental milestone,
May I ask you, what is the relevance of body weight when it comes to the developmental history?
sorry.
Answer the question.
He asked
Developmental.
Yeah. For the developmental milestone, he developed well according to his age.
What you mean
He
develop
can,
well?
he can for the gross motor, he is able to stand alone and walk and relatively stable. For the fine motor, he able to grasp object, and speech, he able to make sounds and relatively respond to sound. And for the social development, he able to laugh.
One Ashraf?
I would like to know about the hydration status of the patient.
Apa?
Hydration status.
Why
Is
you want
there
to know the status of the patient?
because it might be related to the symptom of
Symptom,
the
what symptom?
tachypnea.
How tachypnea cause relevant to hydration status?
Uh, okay, this is my thinking. If it is wrong, correct me. So if the patient is dehydrated or there is a less dehydrated or less volume in the body, the patient might uh, the patient the or less blood in the patient might have low oxygen level that which lead to the tachypnea.
How do you think the child going to become dehydrated? In this case, you think why the child why the child going to become dehydrated in this case?
Oh, in this case, I think just now Amni said that he drink milk 5 ounce and 20 ounce per day. So I think that
Not enough.
is already enough. The patient is
Enough that why
dehydrated.
the child you think they will dehydrated? Why the child going to be dehydrated?
Okay, sorry then. I will ask another question. Okay, so um, when you do the physical examination, the auscultation, is there any heart murmur or related to this patient?
Why not? Answer the question.
No. For the cardiovascular examination, there was no heart murmur. There was normal. No added sound, no heart murmur.
Afiq?
May I ask about his family history? Maybe his other siblings experience the same symptoms.
No. His other siblings does not experience the same symptoms, but his fourth brother have asthma.
His what? Brother?
Yeah.
His brother got asthma. So how is his brother asthma?
That was not mentioned here. You mean the control? Is it
The brother asthma, medication, not on medication or whatsoever.
the his brother asthma was not detailed here, was not explained in detail here.
Not in detail.
Yeah, so I don't know.
What you want to know if you are going to clerk this case?
I want to ask if his brother's asthma is well controlled or not, and then where did
How you
when
know? How do you know that his brother asthma is well controlled or not?
by looking at the exacerbation.
Exacerbation. How you decide asthma is well controlled or not well controlled?
Based on the severity, so we have to know the duration of the symptoms, the number of
Apa symptom dia? Which symptom you talking about?
cough, wheezing, chest tightness, and also cough, wheezing, chest tightness.
Ya ke?
The symptoms of asthma, is it, doctor?
No, which symptom you want to ask about the control?
Which symptom?
Yeah, you want to ask about you want to ask the brother have got control or not?
The breathlessness.
1 year and 6 month old. 1 year 3 month old told you that his breathlessness. You tak tahu ke apa tu well control asthma? Tak present ke?
Well controlled when there is a lesser number of exacerbation, like 2 exacerbation only per year.
Itu je.
And then what?
Buku apa you baca tu? Mengarut tu buku tu?
Fit protocol.
Fit protocol baca baik kontrol asma.
Level of asthma control. Oh, is it well controlled, partly controlled or uncontrolled? Oh, okay.
Kalau well control apa?
Kalau well controlled, the patient have no symptoms of daytime asthma.
Lagi?
No nocturnal symptoms such as no waking up to dyspnea during night. And then he does not need a reliever for his symptoms.
Lagi?
And also he does not have any activity limitation. So we can.
Apa?
He does not have any activity limitation due to asthma. That's all. And also the symptoms does the symptoms happen less than 2 times per week.
Symptom apa? Kalau partially control?
Kalau partially control, he have 2 of these symptoms, 1 or 2.
Kalau bad control?
3
Poorly
to
control?
4. 3 to 4 of these symptoms.
3
to 4 of these symptoms.
Susah.
But the symptoms here refer to that wheeze, coughing, breathlessness, and chest tightness.
Any other question? Any other questions? No question. Betul, tak ada questions. Tak ada question, I start to ask question.
For nutritional history, what kind of formula milk that the patient use?
His mother mentioned that he drank formula milk from Dumex Dugro.
Any other question?
For past medical history, does the patient have any underlying disease before?
Based on the record, he was hospitalized for 2 times. The first one was when during after birth, 1 month 2 days after birth, and the second one during his 4 months old because of the same symptoms, the same complaint.
Any other question?
May I ask if the patient has any drug allergy or any food allergy? Any known?
No, he has no known drug or food allergy.
The drug history, does he have been given any medication, means traditional medication that the mom's trying?
No, as for I know that he was only given paracetamol in order to reduce the fever, and other than that, no traditional medicine was reported.
How about the bowel habit? How many diapers he changed per day?
He changed diaper 3 times per day, and his mother reported that the stools were normal.
I would like to know regarding his social history. Does any of his family members smoke, or does he have cats at home? A pet.
Yes, his father and also his two eldest brother smokes, and then he have a pet cat.
Tak ada question lah. Sazwani, how bad is it the shortness of breath?
I would say that it's mild, mild
Why you say mild?
because the patient have the patient is tachypnea and also
Patient is?
patient is tachypnea
Lagi?
and but the
Itu je?
sekejap. I will look at can I say because the mother did not complain of any if the mother didn't complain any abnormal crying
Abnormal apa?
crying
Crying.
because in
How,
my
how, 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 how abnormal crying related to difficulty shortness of breath, severity shortness of breath?
maybe if the the shortness of breath is severe, the baby can the child can have um, weak cry, or maybe he doesn't make sound too much.
Did the baby have weak cry or sound too not sound so much?
No, it did not mention that.
If you not mention, how you want to know?
Maybe
Huh?
I'm not sure. Maybe because the mother did not
If you
mention.
don't know, you want to know something, yang tak mention, apa you buat?
Ask the mother.
Ask the ask mother ada kasi tak?
Ask the one that collect the mother.
Huh?
Ask the one that collect the patient.
Siapa kelak the patient?
Okay, Amni.
Huh?
Amni.
Dah tu tak tanya dia.
Okay, I want to ask Amni, does the mother have complained any of that?
The crying, is it?
Yes, the crying, or even if any difficulties in sound, for the sound, because the patient is 1 year, because maybe he cannot speak in simple sentence yet.
There was no reported crying, but then during physical examination, There was a
No report
subcostal
apa?
recession.
Dia tanya soalan tu. Kenapa you jawab benda lain, jawab benda lain?
No.
Is there, is not there, you don't know.
Not there. And
Not
I don't
there.
know.
No be crying. Why you say that?
Because it is not reported here.
Not reported, you mean that it's not there ke? Or people didn't ask?
I think.
You mean that everything is not there? You mean that you mean if everything is not there, you mean that everything is not written there? You mean that it's not there?
I think the question is not being asked.
But Sazwani, I'll ask you, is it enough to make decision that is the severity of the shortness of breath?
No, I think I would like to ask about the pulse oximetry, the oxygen. Pulse oximetry, the oxygen pulse oximetry.
In history. We're talking history. Still in the history.
So, because Amni mentioned that there is no the work of reading.
No.
I know. Okay. I think I want to ask Amni if the patient have any nasal flaring or fatigue.
Ada apa? Tak dengar.
Nasal flaring or fatigue.
No. During
no.
No. There was no nasal flaring.
Ada tak statement there's no nasal flaring? Ada?
No, not mentioned here. So we couldn't say that it's not, that is absent, right, doctor?
I tak tahu. You the one who present the case. For us, like this. For us listener, I'm a listener lah. If you don't mention, because there are dalam history, there are positive history and negative history. Negative history katalah a patient have no nasal flaring. That's negative history, which is as important as there is a nasal flaring. Positive history, equally important. And for us, if you not mention it, it means that you don't look for it. For us, if you don't mention it, it means that you don't look for it. That's why, because if you look for it, you will mention there is a nasal flaring or there is no nasal flaring, because that is equally important.
I couldn't find the nasal flaring. He did not mention.
I don't know.
No,
I said to you, a statement of there is nasal flaring, there is no nasal flaring is equally important. So I don't know. Najia, what you think?
Regarding I think are you asking about the patient's
is mild, moderate, or severe?
If what I could say, I would suggest that it is moderate because the patient, she mentioned, Amni mentioned that the patient woke up being irritable.
Irritable means the patient got meningitis.
But it is a symptom of moderate respiratory distress.
How you know? From where you get it?
Uh, just a finding from Google.
Google. Irritable. Siapa tulis tu? Doktor. Doktor tu kena belajar balik. Irritable is a condition of brain inflammation which is particularly of the meningitis or encephalitis. We don't use irritable. You know irritable mean? Irritable. Cuba buka irritable. Apa maksud irritable?
Irritable means easily annoyed.
Easily?
Annoyed.
Annoyed. Ha.
But that could okay.
What we use the word? Itu saja. If budak tu apa tu kepanasan, budak itu dahaga, don't you think that the child is easily agitated?
Yes, that can be the cause of
Then
agitation.
how you say that that's a to indicate severity? Wah, this group paling teruk. Tak dapat analyze history lalu. Umi, what do you think? From you have listened the history, you ask question already. So what you think the level of shortness of breath budak ni? How severe is it? Umi?
I think it is moderate.
Why?
Because because there is chest recession.
Lagi?
And then
why it can't be severe?
Because I'd like to ask Amni if there is any lethargy.
I already ask you peluang nak tanya dah. I already give you chance to ask question what? 2 kali we chance you all. Sekarang is my time to ask question.
I think because there is also agitation when he woke up.
Okay, why it can't be severe? You don't think it's mild? Okay, fair. But why can't it be severe?
Because the patient has tachypnea during rest and not playing.
Ada Amni mention tachypnea during rest.
Ada.
Ada mention?
Yes.
Huh?
Yes.
If tachypnea during rest, moderate or severe?
Moderate.
Huh? Moderate?
Severe.
Severe? Huh? Severe?
Yes.
Izian, what do you think?
I think it is mild because
mild with chest recession.
Moderate.
Oh. So mild or moderate?
Moderate.
Moderate. Why not severe?
Because this patient can tolerate feeding.
Tolerate feeding. Still able to tolerate feeding. Amni?
Yes, he able to.
They tolerate feeding.
Yes, his feeding was normal.
Huh?
It is mentioned here that his feeding was normal.
Feeding was normal. But the child is takipni at rest.
Yeah.
What's the other thing you want to, or evidence you want to decide? Is it severe or moderate?
Is it the pulse oximetry?
Apa?
Pulse oximetry.
Possibility mother can tell you.
No. Mother can tell, but we need to proceed with the investigation.
Pardon?
The mother can tell, but maybe we need to proceed with the investigation, or can't we?
Investigation?
Yeah, I mean to check the pulse oximetry.
Where you want to check it?
Where? Where is the pulse oximetry?
Where you want to check it?
Why or where, doctor?
Where?
Where? At the fingers? Fingers.
Where you want to check it? When you want to check it?
After the physical examination.
But we have you proceed to physical examination?
Not yet. Sorry, doctor.
We have not yet proceed to physical examination. But what can you observe to know that the patient is good saturation, not good saturation?
Look for any cyanosis.
Ada tak?
No cyanosis, no palo, and the child had warm peripheries.
Hati you only lembab sikit berkumpulan lain. Tak apa grabs lagi tu begitu. Nabiha, you think the cough is, how bad the cough is?
How bad the cough? Does it mean the severity? Is it the severity of the cough? I think it's mild because it is only dry cough. I think it is mild because it is only dry cough.
Dry cough is mild. Orang TB tu dry cough ni tak ada. Dry cough dry or wet, this you can tell from that, you can tell it's mild, moderate or severe. Teruknya. Al-Hakim.
I think the cough.
Okay, we cannot hear you.
Oh, sorry. Okay, the cough is moderate because it's, I mean mild. It was not exacerbated by.
Hakim tak dengar.
Hello, dengar? Okay. The cough is intermittent, so and there's no specific pattern. Plus, there's not the patient is not exacerbated by dust, pets, or allergens, and it also not worsen at night.
So that the cough will tell you if it's severe or not severe. The cough worsen at night, so you mean that severe lah.
It's not worsen.
Pardon?
It was not worsen at night.
Not worsen at night. Kalau worsen at night, severe. Kalau daytime dia cough merah, night time dia tak cough merah, muka You mean that not severe?
Yeah.
The daytime dia cough sampai merah-merah muka. Night time dia tak cough pun. Tak usam pun night time. Tak severe lah. Huh?
Can be severe.
Do you think that your reasoning is silly? Like stupid, silly? Huh? How you know the cough is severe, not severe? Wet, not wet. Itu. Wet cough is more severe than dry cough. Tak boleh fikir ke you all ni? Memang tak boleh lalu nak fikir, tak boleh nak imagine. To know to decide the cough is significant, not significant. Ashraf?
The mother said that the cough is relatively mild, and based
Mother
on the
said?
history,
Mother said?
Wait.
You doctor, bukan you doctor.
No, but we based on the history, the cough is just intermittent, not what we call continuously, and there is no associated like symptom like hemoptysis or
symptom like associated symptom like apa?
There is no based on the history, the other associated is other than cough, tachypnea, and
my question is cough. Ada tanya tachypnea.
Cough.
You see, you all can basic
sorry,
basic thing we go, but the cough pun tak boleh nak. Ni macam you nak kelak kes. Basic symptom cough, tak boleh decide how the cough is severe, not severe. You cannot decide the cough is significant, not significant. Basic symptom, basic things, you know. Cough, fever. Bila tanya fever lagi, do you think fever is significant, not significant? Tak tahu. Baru cough. Afiq, you dengar history, you dengar saja. You tak boleh nak, otak you tak keluar, tak nilai history tu. What type of cough? Tak tanya lagi.
I want to ask if
ask pula, you dah ask lah. Berapa kali dia tanya, ada history, ada nak tanya apa-apa, dia tanya apa, semua tak ada tanya apa-apa. Sekarang tanya apa dah? So you dengar history, you dengar macam tu je. Kalau you buka mana buku, kalau you baca lah buku, mereka tulis cough, type of cough, severity of cough. What you think, cough? Amni, how sure you is wheezing?
How sure is the wheezing?
You mentioned there is a wheezing.
Yes. The wheezing occur when he was.
How sure are you it's a wheezing?
How sure?
Yeah. How sure are you, Susie? Why it's not straight off?
Because
You don't think it's straight off?
stridor is for upper airway obstruction, right?
Both can have bunyi sound.
Yes.
Check the complaint of. So how sure is wheezing? You're not straight off.
Because it was wheezing expiratory. Because it was heard during expiration.
It mentioned there. Did he mention that?
Yes.
Mentioned during expiratory. Written there.
But
did anything written there? The sound during expiratory.
Wheezing when breathing.
You see difference between me and you. I don't need to check now. I listen to history once already. I know already. Why you need to check again? Don't you study the history or not? Surely you dapat 2-3 hari dah kes tu, kes ni. Why you don't study the history? If you study the history, if you ketika, you sure ke wheezing this one? Tak ada mention, tak describe pun the breathing sound.
No, they just mentioned wheezing was heard.
Then how you know it's wheezing?
You have to.
You see, my mind is different tau. I dengar dekat wheezing sound was described. How you know it's wheezing? You baca, you tak otak you tak ni, tak analyse macam tu. You percaya bulat-bulat history tu.
A little bit confused.
Ya, dia kelak tu dia dah doktor dah.
No, not yet.
Then you trust history tu.
Not really.
You baca history tu, the first thing you trust. You tak ada skeptical.
No.
You baca history tu, you tak ada you skeptical. Betul ke? Dia tulis wheezing. Betul ke wheezing? You check tak? What is the evidence of the sound is wheezing? Tak ada, you tak check.
No, because I think wheezing we should.
Yes, you see, I'm looking in your brain. If you have a thinking skeptical about the history, you will answer to me earlier. It was written inside the note is wheezing, but there's no evidence or describe that is a wheezing, because the wheezing occur at the expiratory and the sound is whistling like, but they have not mentioned anything else inside the history. Then I understand that you already analyze the history and you have some skeptical of the history. You understand or not?
I understand, doctor.
It's not about the history. It's about your brain. I'm analyzing your brain. How do you, how critical are you about the history? Because I want to listen to see how you argue of your point. And you see, what disappointed me is that you have to recheck and recheck. No, by right, you don't need to recheck already because you already read the history for a few times already, and you already know what is there, what is not there. But you still unable to tell me what is there, what is not there. You don't need to go back, check. You already, oh, it's not there. Yeah, it's there. It's not there. Yeah, it's there. Son, I know that you well versed with the history. It doesn't matter if somebody asks history. You have to check. Oh, tak ada. We have to check again. We have to check again. I say, oh apa? Ni history dah bukan panjang sangat. Oh, history ni you boleh hafal. Tulis balik kalau you nak. You baca 5 kali, you boleh hafal dah. History ni. You already know what is there, what is not there. You already can tell me, oh, he only mentioned his wheezing, but he did describe the wheezing. You should be able to answer that. You know, that's the level of thinking I expected from you. As I say, it's not about the history. It's about how do you understand the history. How much the history you already have the notes with you for a few days. How much you understand history that you are presenting. Sazwani, what the essence of the case?
The essence of the case, a 2-year-old boy, a 2-year-old pregnant boy with
Tak dengar.
a 2-years old boy tachypneic child with pneumonia.
Najihah, ada tak kita bincang masa diagnosis?
Tak ada.
Najihah, you tahu last group kan? The last group I ajar group 1 tu. That boy boleh answer I macam ni je. The essence of this case is this. This is asthmatic. This is a nephrotic child who having relapse. Wah, cakap. You answer macam tu lah. This is a 4 years old boy who are nephrotic and having relapse. You know, first tanya macam tu, dia answer macam tu lah. So very solid thinking. Otak dia memang solid. No, he understand the case. Najihah?
Yes, Doctor.
Essence of the case.
I will answer. The essence of the case is a 1 year and 2 months old boy with tachypnea.
With tachypnea or shortness of breath. So what the next thing come to your mind?
Means the differential diagnosis or?
Before you want to go to differential diagnosis, what the thing come to your mind? Something you have to have before you can go to differential the possible causes.
Any obstruction on the respiratory system?
Umi apa benda? Because you ask yourself, this is a 1 year, 1 month old boy who are having shortness of breath. Or you can say in 3 days, or acute shortness of breath. You come to your mind, why this child, what the causes of this child having shortness of breath? To answer the question, what the causes of shortness of breath, what the thing that you have to have? Because if you don't have this thing, you cannot answer the causes of shortness of breath.
A list of differential diagnoses? We have to have a list of differential diagnoses?
You have to have the list of
differential diagnoses.
Not differential diagnosis, the list of
possible causes.
Causes of shortness of breath in this age. Tell me what the causes. The possible causes at this age, the causes.
Bronchiolitis,
Lagi?
pneumonia,
Bronchopneumonia lagi?
asthma,
Asma lagi? Tiga je?
upper respiratory tract infection,
URTI. Apa URTI? Rhinitis, allergic rhinitis, pharyngitis.
epiglottitis, epiglottitis,
Bronchitis lagi? Stroke lagi?
laryngitis,
Laryngitis, cause shortness of breath. Laryngitis, pharyngitis. That one, laryngitis cause shortness of breath. Kalau epiglottitis betul lah, stroke betul lah.
Assalamualaikum warahmatullahi wabarakatuh. Perhatian kepada semua kekitangan Sultan Ahmad Shah Medical Center, para pesakit dan pelawat sekalian. Waktu salat zuhur akan masuk dalam tempoh 15 minit daripada sekarang. Marilah kita bersama-sama menunaikan solat di awal waktu kerana Nabi Muhammad SAW pernah ditanya, apakah amalan yang paling terbaik? Lalu baginda menjawab, solat di awal waktunya. Untuk makluman, solat fardu boleh dilaksanakan secara berjemaah dan mengikut SOP yang telah ditetapkan. Adalah dimaklumkan bahawa tiada pelawat dibenarkan untuk merawat pesakit dalam tempoh PKPP. Hanya seorang penjaga dibenarkan untuk menjaga pesakit diwat pada satu-satu masa. Sekian, terima kasih.
Apa lagi?
aspiration of foreign object,
Okey, lagi?
cystic fibrosis,
You talking about how many days? You talking about acute, yeah? Itu je. Amni, you check mana tadi tak? You check all the courses?
Yes.
You check or not?
Yes.
Eh?
Yes, Doctor.
You check the causes of shortness of breath in this at this age. You malam tadi you check tak?
Yeah, check.
Tell me the causes. Berat you dah macam ni dah.
Do I have to mention the early?
Apa benda you tak mention lagi?
Cardiac failure.
Lagi?
Atopic asthma.
Dah mention asma dah. Lagi?
Non-atopic wheezing. Inhale foreign body.
Dah mention dah. Apa lagi?
Aspiration of fits. Aspiration of fits.
Lagi
transient early wheezing.
Itu je. Lain tak ada.
The other are already mentioned, like bronchiolitis, pneumonia.
I dalam kepala I lagi banyak list ni. Inside my brain ada lagi list. My brain. Pneumothorax, pleural effusion, acidosis, severe anemia. Macam mana boleh ada? Where you can get all the list?
From the books.
Books baca tak mana tadi?
Yes, I read it. Yes.
You read? Why do you think why is not expression why is not foreign body injection?
Because it is not stridor.
Are you sure it's not stridor?
And his mother also mentioned that when he was leukemia, he does not do any activity, not playing or
Is it the most important history? What the important history you want to know is not a foreign body?
important history.
Dia dah 1 year old dah, 1 year 1 month dah boleh capai dah bagang. You can reach for object already. Put things in.
No history of choking.
Why you don't mention it? If you present, you read it last night, sure you're going to present to me. In the history, however, they don't mention anything about choking episode, in which I think important for differential diagnosis. Why they not mention those things to me?
Sorry, doctor.
I expected you to comment the history. You're not satisfied with the history, you comment. History, for me, history is not complete. That show to me you doing your homework. Isian, is it crook?
No, because there's Amni mentioned before, there is no specific pattern or characteristic of the cough. Like for
Nobody knows. Nobody knows. Nobody asks.
But Amni mentioned it when her present the.
Apa dia mention?
She said that the cough does not have any specific pattern.
Pattern. What you want to listen for the cough when the child is croak? What kind of cough?
Barking cough.
Barking cough. Barking cough tu pattern tu characteristic.
Characteristic.
Anybody may asking? Anybody mention?
No.
Then? Nabila, is it heart failure?
I think it is impossible because the patient does not present with cyanosis.
Itu je. Not cyanosis. Asma pun tak cyanosis.
Or edema.
Bronchitis pun tak ada cyanosis.
Edema. And
Edema apa?
Edema of the pedal.
Ada ke mention? Ada mention, ada tak mention?
Not yet.
Not
yet.
Mention, you mean that is not there? If it's not there, what you were expected? There is no edema. So do you think the child heart failure or not? From the history you listened just now, you had listened the history. You not try to create another history at all. One of the reasons we fail students is create another history. You have listened to the history. They still told you that's it. That's all. You cannot assume. As I say to you, in history, positive history, negative history is same important. Understand? So what you listen is there, is not, is there lah. It's not there lah. All has to be mentioned. So if you think the child is having heart failure or not? Ashraf, what do you think?
From the history itself, Doctor. So from the history itself, the mother, one of the characteristic of cardiac failure is the pedal edema, or so, and so and the other is and based on the system review, the CVS is normal.
You ni kerti bahasa ke tak? Kau tahu kerti bahasa? Kita masih dalam HOPI lagi tau. You don't go beyond that. You tak layak tak go beyond HOPI. Kita tak go for systemic review tau. You nak bohong apa?
And I already asked about the heart murmur. There is no heart murmur.
Masih be heart murmur to be heart failure. There are many cases of cardiomyopathy. There's no heart murmur.
Okay, and there is no poor growth, no poor feeding. Maksudnya the patient feeding can tolerate feeding, and growth is the growth is normal.
You discussed about the growth just now. Anybody ask the question about the growth? Anybody ask the question about growth? Feeding lah. Somebody ask feeding, but then it's not very. The feeding doesn't very, what you mean by tolerate feeding? Amni, for 1 year and 1 month old, if the child had heart failure, how the feeding going to be?
Poor feeding. You have poor feeding.
Poor feeding maksud dia?
He resists eating and feeding.
Apa?
He resists feeding. But then it is not mentioned about that here.
Like what?
His mother does not mention about any poor feeding history.
And what you mean by what kind of feeding they have if they have heart failure?
What kind of feeding?
See, you tak check kan? The child can feeding daripada 20 minutes become 40 minutes. Still tolerate. The child can feeding, but sekarang feeding berhenti sekejap, berhenti kerja sekejap. You can still tolerate, but boleh feeding berhenti feeding. Feeding dia berpeluh-peluh, sweaty with feeding. Tapi dia kan still tolerate. Tapi mother say, feeding dia berpeluh-peluh.
So poor feeding and can tolerate feeding is two different things.
Poor feeding probably he didn't finish daripada 40 cc, 20 cc je. Tolerate feeding, he can tolerate the feeding. Dia kan habis the feeding. But it can be take longer time. I ask you one question. If you read the causes of shortness of breath in this child before you present the case, you analyze the history, would you present differently?
Yes. Yes, I think I would present better, but then I only read some of them, not all of it.
Why some? Don't you think that you miss the opportunity to study this case, to study a child with shortness of breath, to become good in that, Then when you present, you're very good knowledge about the child and shortness of breath. So when we discuss, people ask you, you tak like that, and you challenge your brain, and then you can remember it for a long time because you already present this kind of case, and you have knowledge to back up of your presentation. Why you want to miss this opportunity? Yeah. No, I'm not. You sorry to me for what? Sorry for yourself. This is a good opportunity to you to study about bronchiolitis, bronchoasthma, bronchiolitis. You tengok this case. Why this case bronchiolitis? Why this case not bronchiolitis? Why this case is asthma? Why this case not asthma? Why this is bronchopneumonia? Why is not bronchopneumonia? Why this case not epiglottitis? Why is this case not foreign body ingestion or expiration syndrome? Why is this case not heart failure? I tak faham kenapa you nak belajar cara susah. No, nak baca topik, satu topik. Lepas tu sebab apa nak ambil exam? When you study it around your patient, you will learn more. Boleh learn more dan boleh faham more dan boleh create your critical thinking. You piece opportunity lah. You think you dapat chance lagi macam ni? Somebody else will present lepas ni. Then we can discuss higher standard. If you know the courses very nice ni, kita boleh discuss very higher standard level of discussion. You know higher standard level of discussion? Tak boleh pergi basic-basic macam ni. Because you dah grasp you punya ni. I can teach you higher level of thinking. No, basic thinking pun you tak boleh dah tu. Because you kena back up everything discussion with the knowledge. I'm not going to teach you, okay, apa tu heart failure. I cannot to teach you apa tu asthma. Why? I won't teach you that. Because you can read it and find it yourself. My job is how to tie asthma dengan this case. That's my job. How to tie heart failure with this case. That's my job. But if you don't have basic knowledge, strong knowledge of that, how are we going to tie? Start. You study the case. How long you take to study the case? Satu hari suntuk. Satu pagi tu you start pagi semalam atau pagi ni you study about the case because you're not going to present orang can present for the other case tapi duduk study the case. Oh, I have the case with shortness of breath. You baca all the causes shortness of breath. One of the causes heart failure. You baca heart failure punya sign and symptoms. You tengok this case. Oh, this case tak ada history of heart failure, heart disease, tak ada case of klinik with ni, coughing pun tak ada wet, coughing dia tu is probably edema or not, tak ada sign evidence of heart failure in this age. Rugi kan? Miss opportunity. Tapi you all sama je. I found out you all the Malay are like that. Only 1 or 2 cases daripada 10 seorang orang yang Malay yang betul-betul when they want to present the case, they study the case before they present. Study really the case. So I tak boleh nak pergi, I nak hit belah kanan tak boleh, I nak hit belah kiri pun tak boleh sebab dia solid. Knowledge dia solid. Tak boleh nak hit. I pusing tanya belah kanan dia boleh jawab. I pusing tanya belah kiri pun dia boleh jawab. Ada few lah. Tapi daripada 10 seorang orang je. Most of the time you all tak prepare cases macam itu je. Because you know you don't have pride. Proud. You see when some people they're very proud of their presentation. Pride dia tinggi. They don't want to be hit. Get hit. You know kalau dengan Datuk Fadzil ni kalau present dia akan scrutinize everything. Ni dia akan prepare. Dia tahu kalau Dr. Said akan present dia style macam ni. Dr. Taufik macam ni, kalau Datuk lain dia style dia akan scrutinize. Dia tak impress orang tu ni, dia tahu orang tu dia nak orang tu defend dia punya history. Then you take somebody else's history, it's okay, tapi you can comment history for me is not complete. No, there's thing that history is lacking. I pun cakap, very good, this will he doesn't mention this thing which I think is that he should have mentioned. So you see, so very critical. Up to you all lah, macam mana you nak belajar. Tu saja. You decide how you want to be, how you learn. I dah mengajar, as I said to you previously, I dah mengajar berpuluh-puluh atau ratus orang lah, 20 years. Daripada ni, I dah mengajar apa tu Chinese, Indian, Mak Saleh pun dah belajar, I mengajar. I already teach so many people. Cuma I can see the private student, they are really take, bila I scrutinize the history, dia orang dah depressed lah. Because they really prepare. A private student, when I teach private student, different. They really prepare the history. Any question?
So Doctor, I have a question. So for this case, we should not satisfy with the history and should.
Of course lah, the history. You see, you think this history is what's there in history? I cannot decide how severe the child is. Even I cannot make a lot of differential diagnosis. Even I don't know the important, because I have the feeling that this child related to the prematurity. Probably something, the lung already has something there. Because 1 month in there, I would like to know history about what happened in 1 month in the ICU, ventilated, not ventilated. You can tell me the state of the lung of this child. But you see, how to go higher up discussion when you all at this level pun you all tak boleh go lagi. These are higher level discussion now. Tapi before you can go to higher level discussion, you must be able to make a diagnosis and differential. Why is not there? Why is not epiglottitis? Why is not throat? Why is the name? People can argue to you. Why? You might be able to answer. Throat. If you thought that earlier, you will say, you will ask someone, you will tanya, oh, budak tu ada coughing, parking tak? Nobody ask. Because your mind tak ada ketika. Dalam otak you all. Nobody ask about barking. Cough. Then I know that you all will cross in your mind. Because your otak you all otak narrative. Itu narrative otak. Narrative. You listen and you just listen dia. Dia tak analyze. Oh, cough. Dia budak ni ada cough. Significant tak? Is it the cough indicate can point as a diagnosis or not? Tak ada. Tak whooping lagi. There are many level of discussion. No point to go higher up if you cannot go on basic discussion. Any other questions? Any questions? Any other questions? Dia depressed pula ni. Take it positive. Cuma use the opportunity. Every time you not present, you must be proud of your presentation, and then you study the case. You study the case, you remember it for a long time. Look, very simple, shortness of breath. Tapi you tak tahu shortness of breath is one of the main reason that child admitted to the ward. If you can solve the problem of shortness of breath, you will master the case of shortness of breath. You already can handle 60-70% of the cases in the ward. Any other question?
So, Doctor, it is more effective if we could learn the disease by its shift complaint instead of system.
Because there is problem solving. You see, when a patient come to you with a set of problem, their problem is the chief complaint. Your job is to solve the problem, is to solve the chief complaint. That's why in any case, if you are unable to decide what the chief complaint, you have to stop there and keep asking what the chief complaint. The chief complaint is what bring the child or the mom bring the child to you, to see you in the hospital, in the clinic, or wherever you are. Because nobody come to see you suka-suka. I don't see you ada pernah jumpa ke somebody suka nak jumpa doktor, nak melawat doktor saja? You must something why they want to see you. So that is the chief complaint. That's your job. Your job is to solve the problem. Dia mak dia takkan datang, oh anak saya kena heart failure. The mom won't come, anak saya kena ada bronchiolitis. The mom won't come, nobody will come with that. They will come with you set a complaint which indicate it is probably a bronchiolitis. So in clinical, your thinking have to be from backward. If you thinking bronchiolitis first, then you go forward, you cannot solve the problem. Your thinking is from the shortness of breath to backward to bronchiolitis. That's your thinking. Why is it it is bronchiolitis? Why is it not asthma? That's your thinking going to be. Any question? Susah? Senang? Susah senang? Ini susah?
Susah. Susah juga.
Susah. Tapi 90% pass. Bukan kenapa 90% pass, bukan 50% pass, kan susah. Any subject kalau 90%, 95% pass, susah ke senang? Ni?
Senang lah kot. Senang lah kot kalau 90% pass.
Subjek 95% pass. You tu fizik, masa dulu sekolah fizik, you tu dapat ke 90%, 95% pass? Medical, 95% pass. Susah subjek tu. Susah ke you takut, fear? Positive thinking people, they will think I will be the 95%. Negative thinking dia, I will be the 5%. So what kind of thinking you have? You know, positive thinking people, they were thinking I will be in the 95%. The negative thinking person, he will think I'll be in the 5%. Siapa yang akan suffer? Hidup bahagia. Orang yang fikir he is a 95%, orang yang fikir he is a 5%. Siapa yang hidup tak bahagia?
5% tak bahagia.
Yang 5% tu akan tak bahagia. Always living in fear, betul tak? Whereas in the real world, most of you are in the 95%. But majority of you, you're thinking macam mana? You are in the 5% or 95%? Majority of you.
5%.
I
think I will go for 95%, but we have to improve more and we have to struggle a lot.
You're always thinking you're probably more in 5%. What kind of life? Hidup betul mimpi ngigau agaknya. Siannya lah hidup. Masa muda lepas tu. Kalau masa tua kita orang ni tak apalah, mungkin dah short life. Ya orang semua muda tapi hidup dah depressed lah. Depressed. Fikir I am in the 5%. Muda sekali je hidup sekarang dalam hidup itu muda sekali je, tahu kan? Imagine hidup muda tak bahagia. Susah hati. You cannot take back the time yang you lost. Okay, any other question? Tak ada? Okay, good luck. Macam mana bila you boleh balik sini, I tak tahu. Sekarang ada darurat pula. Panjang lagi cerita. Darurat buat tu. Tahu lah, I don't know. Hopefully we can sort out vaccine, all those things nanti. Probably we think more clear. Okay.
InsyaAllah.
Okay, okay. Tak ada apa dah? Okay,
Thank you, Doktor.
Thank you so much, Doktor.
Kalau kita tahu macam tu, balik baik kita study each symptom kan. Study each symptom, pasal bagi setiap orang satu disease. So dia boleh tanya kan.
Memang tak klasik pun. Dah macam kita nak.
Kalau kita tahu each symptom tu, dia punya severity tu, my goodness.
Okay lah.
Tak tahu tak terfikir pun nak study.
Sabar ambil gambar tu, gambar stres ni. Gambar stres.
Thank you semua.
Jangan ambil gambar tu.
Tak nak ambil gambar.
Amni sabar.
Sabar aku ucap Amni. Thank you Amni.
Dapat Amni, thank you Amni. Amni banyak membantu.
Thank you semua.
Sekejap, nak screenshot. Dah, Amni nak buka tak?
Amni buka lagi kamera. Kejap je.
Tak nampak pun.
Nangis ke?
Mana ada?
Nangis ke? Alah, jangan nangis. Tak apalah. Buka. Oh nangis dah, ya Allah.
Kita tak ada lagi subgroup ni.
Mantap dah, 95% dah.
Tak, dia macam sebab kita tak tahu kot macam mana.
Okay. Senyum semua. 1, 2, 3. Okay, sekali lagi. 1, 2, 3. Alah, ni tak nampak muka.
Thank you.
Kita haru ke apa? Bahagia.
Okay, sekali lagi.
Tapi Doktor bagi
dah habis lah.
Sangat lah hujung-hujung.
Okay. Sekali 1, 2, 3. Okay dah. Okay, thank you semua.
Thank you semua. Thank you.
Salah Zoho.
Thank you semua.
Thank you.